Hi everyone, this is Becky with Appalachian Ideas and a warm welcome back. Today I'm going to talk about COVID-19 vaccination hesitation. If you like what you see, feel free to like, subscribe, or share the video. Somewhere along the way, COVID-19 vaccination has gotten away from the medical facts and somehow become meshed with politics and money. Now, as citizens, or I should say consumers or people receiving the vaccine, we need to know the medical facts and stick to the medical facts alone when deciding whether or not to get the vaccine. I'm going to read an article to you from WebMD briefly that just is an overview about coronavirus. What happens when you get infected with coronavirus? There are many types of coronaviruses. Some give you the common cold. The new coronavirus behind the 2019 to 2021 pandemic causes an illness known as COVID-19. How does COVID-19 attack your body? A virus infects your body by entering healthy cells. There, the invader makes copies of itself and multiplies throughout your body. The new coronavirus latches its spiky surface proteins to receptors on healthy cells, especially those in your lungs. Specifically, the viral proteins burst into cells through the ACE2 receptors. Once inside, the coronavirus hijacks healthy cells and takes command. Eventually, it kills some healthy cells. How does coronavirus move through your body? COVID-19, the illness caused by coronavirus, starts with droplets from an infected person's cough, sneeze, or breath. They could be in the air or on a surface that you touch before touching your eyes, nose, or mouth. That gives the virus a passage to the mucous membranes in your throat. Within 2 to 14 days, your immune system may respond with the following symptoms, including fever, a cough, shortness of breath or trouble breathing, fatigue, chills, sometimes with shaking, body aches, headache, a sore throat, congestion or a runny nose, loss of taste, loss of smell, nausea or vomiting, or diarrhea. The virus moves down your respiratory tract. That's the airway that includes your mouth, nose, throat, and lungs. The lower airways have more ACE2 receptors than the rest of your respiratory tract. So COVID-19 is more likely to go deeper inside your lungs, where your blood exchanges oxygen and carbon dioxide. COVID-19 is more likely to go deeper than other viruses, like the common cold. Your lungs will become inflamed, making it tough for you to breathe. And this can lead to pneumonia, an infection of the tiny air sacs called alveoli inside your lungs, where your blood exchanges oxygen and carbon dioxide. If the doctor does a CT scan of your chest, they'll probably see shadows or patchy areas like ground glass opacity. For most people, the symptoms end with a cough and a fever. More than 8 in 10 cases are mild, but for some, the infection gets more severe. About 5 to 8 days after symptoms begin, they have shortness of breath, known as dyspnea. Acute respiratory disease syndrome, ARDS, begins a few days later. ARDS can cause rapid breathing, a fast heart rate, dizzying, and sweating. It damages the tissues and blood vessels in your alveoli, causing debris to collect inside them. This makes it harder or even impossible for you to breathe. Many people who get ARDS need help breathing from a ventilator. As fluid collects in your lungs, they carry less oxygen to your blood. This means your blood may not supply your organs with enough oxygen to survive. This could cause your kidneys, lungs, and liver to shut down and stop working. Not everyone who has COVID-19 has had these serious complications, and not everyone needs medical care. But if your symptoms include trouble breathing, get help right away. And what else can COVID-19 do to your body? Some people have other symptoms, including pink eye, rashes, liver problems or damage, heart problems, kidney problems, dangerous blood clots, including in their legs, lungs, and kidneys, and arteries. Not kidneys, I'm sorry, I misspoke there. Some clots may cause a stroke. Now, we don't need a stroke on top of everything else. I don't need a stroke, and I'm sure you don't either. Researchers are looking into reports of mouth sores and skin rashes, including reddish purple spots on fingers and toes. In general, children don't get sick with coronavirus as much as adults do, but they can be infected, and it can also be deadly for them. Some children and teens have been admitted to the hospital with an inflammatory syndrome that may be linked to the new coronavirus. Symptoms include a fever, rash, belly pain, vomiting, diarrhea, and heart problems. The syndrome, now referred to as Multisystem Inflammatory Syndrome in children, or MIS-C, is similar to toxic shock or Kawasaki disease, a condition in children that causes inflammation in blood vessels. We're still learning about these cases. The long-term effects of COVID-19 on your body are still unclear. Some patients have become what is being called long haulers, where they suffer symptoms for weeks and even months. Okay, and then this WebMD article lists tons of sources afterward. Okay, I wanted to mention that I'm a Johns Hopkins graduate. I received my COVID-19 content tracer certificate when this all broke last year. Okay, now that I reviewed the medicine, the medical parts of COVID-19, one thing I want to say to you is, have you ever been in an emergency room? At that moment when you're completely helpless. I don't have the resiliency that I had, the bounce back that I had when I was in my 20s. I'm near retirement age. I have diabetes and epilepsy. And I have arthritis and a few other things, high blood pressure. And I just don't have the resiliency. My body does not. And when I was in my 20s. So if I were hit with COVID-19, I would have a hard time bouncing back. And the vaccine ensures it gives me a little extra push. From what I understand, it supports my immune system more. Gives it a little more, feeds the troops. Now, I will say about the vaccine that it does not contain a piece of the dead virus, and therefore, it, from what I have read, it cannot sterilize the disease and kill it. So it does not prevent the spread, from what I understand. But if you become sick with COVID-19, you will have a much better chance of bouncing back. And if you have ever been helpless, COVID-19, you know what I'm talking about. COVID-19 affects deep in the cells where we have no control. I mean, this isn't like brushing your teeth if your teeth are fuzzy. Brushing your teeth when I have tooth pain, if I go brush my teeth, that usually takes care of it. I'm serious. Or getting glasses if your eyesight is a little off or a little fuzzy than what it used to be. This isn't like that. This is where we cannot reach, where we cannot control. Little cells make up muscles. That is how deep this cell is, and deep for what it affects. So the coronavirus vaccine increases your odds about that. Now that you have this medical facts, all these facts, this medical information, and you can feel free to look up more. I mean, that's what I did. I went for a year and 3 months with no vaccine. I just, I live in a rural state, and I live in a semi-rural area. So I social distanced, I wore my mask, and I washed my hands religiously. And I wasn't in touch with the public that much because I worked at home on the computer. I'm an online teacher, except to go to the store, and there was social distancing there. So I didn't see a need to get the vaccine at that time. Now, mind you, at that time, the vaccine did not have FDA approval. So I did not know how this vaccine would interact with my other health problems or with the medicine that I was taking. But now, since it's FDA approved, that's what I was waiting for. All right, I'm sure with other people, they have individual things that they are looking for. One thing that comes to my mind also, I'm very money conscious. How much is this vaccine going to cost in the future? The government is supplying it for free now. In the future, if I decide not to get it, but if I decided later when I would have to pay for it, how much of that cost would my insurance cover? So it's just something to think about. All these different things. But here are the medical facts. Like I said, feel free to look it up. And some of these things like a cough, fatigue, chills, body aches. Body aches comes with age. A lot of things came with allergies. But when I would, like a sore throat, and when I would get this, I would think, oh no, do I have COVID-19? No, I had allergies. Congestion or runny nose, well, runny nose comes from allergies. That's a byproduct of allergies. Anyway, with me, I have never had loss of taste or loss of smell. The other is nausea or vomiting or diarrhea. Haven't really had that. But I have had pink eye. That can also be related to allergies, especially if you're allergic to pet dander. Heart problems. I take steroids and fish oil. I mean, it's just something. Heart disease runs in my family, so that's just another thing I don't need. I don't want to go there. I want to bystep everything as much as I can. So when you're considering whether or not you should get the COVID-19 vaccine, go look up something on the internet. Go to the medical facts and look at those. And don't pay any attention to people calling you names like anti-vaxxers or calling you stupid, because they don't know. They don't know you. They don't know what's going into your thought process. They do not know what you're considering before you get the vaccine. And hopefully, you may arrive to get the vaccine anyway. You may arrive at that decision. I pray that you never get COVID-19. And I pray that no one in your family or none of your friends get COVID-19. I'm glad I got the vaccine. It provides some peace of mind. That's about all I have for you today. To recap, go read a medical article about COVID-19 before you get drawn into a political argument about rights or choices. It is a choice. It's an individual choice. Anything's an individual choice. If I decide to go to Walmart instead of Target, that's an individual choice. All right. Well, thank you very much for being here today. And if you like what you heard, like, subscribe, and maybe share the video. Thank you. See you next time. Bye. Stay safe.